In this video, let's talk about recognizing a patient that may have overdosed on opiates. What does that look like? What symptoms do the patients have? The reason that opiate overdose can be life-threatening is because opiates suppress the respiratory drive. When we take opiates, it makes us less interested in breathing, and it really does. It causes patients to stop breathing. They don't have a respiratory drive. They're also very drowsy. So patients that are drowsy, that are not waking up readily, and that have signs or symptoms of not getting enough oxygen, like their lips are purple, their nail beds are blue, they look like they're not getting enough oxygen, may have had an opiate overdose. What do you do if you suspect an opiate overdose? Well, there's a few things to consider doing, and a couple of them may be doing at the same time. If you have access to naloxone, which, by the way, we recommend that patients have access to naloxone if there is an opiate in the home, then naloxone should be immediately given. Concurrently, 911 should be called. Naloxone gives about 45 minutes of an antagonist to opiates, but it doesn't last as long as the opiate might last. And the patient may have some complications related to the overdose that naloxone wouldn't necessarily fix. And so we want to get the emergency medical services involved. If the first dose of naloxone is not effective, consider giving a second dose. The nasal form of naloxone, for example, is dosed to have 2 doses within the same nasal canister. So you could give 1 dose, and if that wasn't effective, give a second dose. The most important thing about opiate overdose is, first of all, to be prepared by having naloxone and basic education, and then secondly, to recognize it. And the patient that has overdosed is not likely going to be the one that's recognized the overdose. A family member or a friend is going to need to see that this patient is not waking up, they look like they're not breathing, and an intervention is needed.